It is 11 o'clock and the waiting room is cleared. So if you guys want to go ahead and get started, I'll turn it over to you.
Good morning, everybody. Thank you for being here. We'll start off with the introduction of the TAC members. I'll start. I'm Anlin Purden with Hazelwood Home Health.
Susan Stewart, Appalachian Regional Healthcare.
Good morning, everyone. I'm Evan Reinhardt with the Kentucky Home Care Association.
Good morning, Teodis Perez with Green River District Health Department.
I certainly lost Teodis, so I thought everything.
Is that all the TAC members?
I think so. I don't see Marlene, so I think that'll be us for today.
All right. Is there a motion to approve the October 17th meeting minutes?
I'll make that motion. Susan Stewart.
Second.
All in favor?
Aye.
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 Do we get Teodis?
Oh, yeah. Could I have you on camera, please? Thank you, Annalyn. I couldn't find my mute button.
Wonder if he stepped away. Can we move on and then when he gets back,
Absolutely.
finish up that? Okay. Old business. Evan, do you want to take over or do you want me to do it?
Yeah, that's fine. So jumping in, we're just looking for an update on where things stand with EVV. I know we've had a lot of providers reach out and we've asked them all to communicate with DMS and Pam Smith directly. So want to see where things stand, what the plan from DMS's perspective is. We still have our concerns about access and what this might do to some agencies in terms of their participation in the Medicaid home health program directly. So we're just checking in, see where things stand.
Good morning, Evan and Ann. So I will provide those updates for Pam today. This is April Lowry with Division of Long-Term Services and Supports. And we can start with our implementation updates for EBV HHCS. So our soft go live is planned for December the 28th. And we are looking to have everybody we would like to have at least 50% of visits being captured by EVV there in January. So January 1 is the official go live. So we're looking at 50% of each agency's visits being captured by EVV during that month of January. And then I know providers continue to work with THERAP in the onboarding process, as well as getting their members and their PAs uploaded and working with THERAP with the aggregator access. DMS will plan to continue to monitor the implementation and adoption of our providers and provide technical assistance one-on-one with the provider community as needed. We'll continue to also monitor by provider the visits through the month of January, and hoping that all providers can be capturing at least 50% of those visits again throughout January, and then looking to up that to about 75% of the visits by February 1 with 100% by March 1. And we all do know that all agencies will not have like 100% visits. Something will happen. There will be a reason that you have to have in a backup plan, etc. So, that is expected. And DMS will continue to monitor and work with the providers as far as, turning on those hard edits. So if we see the implementation is not going smooth, we will continue to work with the provider community and ensure that, we're at a good point before that, hard editing, it gets turned on in the system. So that's the current updates for where we're at on the HHSCS implementation for EVV.
So, thanks, April. A couple of questions. Do you all have like a bulletin or a letter that you'll be releasing all this information just to make it official for everyone?
Yes, so Evan, we had sent out a provider communication last week. We held a policy webinar yesterday. We will also be posting the link to that. And also I can put the links here in our chat, or I will get them to Aaron to post.
Yeah.
We will make sure that you do that. And we've got several additional communications that will be rolling out as we work towards go live as well.
And then for an agency that doesn't hit the 50% threshold, according to the timeline, what are the consequences for that?
So right now, we will just continue to monitor and work with those providers one-on-one to understand, where they're at in the process. From everything we've seen with the communication we've had with their, nearly all the providers are either completed the onboarding or are in progress of the onboarding process. So, we're going to continue to work with those providers one-on-one, Evan, as we need to.
Okay. I see Susan's got her hand up, so I'll turn it over to her.
April, I think you and I we had an email exchange a few weeks ago about our status with EVV. And I would say we're 10% in. We're still trying to get through all of the contracting and how we're going to handle EVV with our staffing. I don't see any way possible that we are going to be at 50% compliance by the end of January. We're a union environment and we're still trying to work through the nuances of applications, apps on cell phones that are not ARH owned devices. There's a lot of things involved in that. And I just want to kind of be on record in that what we're seeing from across the state is, and we are not doing this, is that agencies across the state are discharging their Medicaid patients and not picking them back up. So this is going to create a access to services issue for Medicaid patients, and agencies are having to make hard decisions about compliance with EVV and getting paid a nominal per visit rate, or don't admit a Medicaid patient. So those are conversations that are being had probably with every agency in the state of Kentucky. And I know that we are not going to be ready. And I have 8 agencies in this. I'm very concerned about what's going to happen. That's it for me.
Go ahead, Anna.
I had a couple specific questions. So I will be at 0% probably until July is when my software has said is a realistic time frame for them to write the program, or to write, because we can already capture it in our system. They just don't have the program written to send that to their app. So I was told that so long as I was working towards becoming compliant, that we would be okay. I sent in my plan and I've never heard anything. So I don't know, am I okay?
So yes, if you send a plan in and you are working towards compliance and we have reviewed it, then you are okay. So, and also I believe that there are a few agencies that are still trying to figure out if they're going to use Therapy or if they're using a third party. Could potentially use, the Therapy platform, while you continue to make those decisions and capture those visits. I know that I had also had a conversation with Susan. I know, Anlin, I believe Pam, I had talked through your email, and we understand, we just need, some plans from the agencies that are continue to work with our third party vendor. So if you haven't sent us a plan to review, you can send that. I will also drop an email address in the chat here for you all, for the agencies to utilize. So Evan and Anlin and Susan, if you all want to get those email addresses out, we're happy to review those provider situations on a case-by-case situation.
So can I expect a response to my plan and what you all think my next steps should be if it's not acceptable, or?
Yes, we will make sure that you get a response back.
Okay. Then now that we've actually started using EBV in our system, we have access. The staff has come up with a few really good questions I never thought of. So access allows people that can't sign to voice sign. Is that acceptable with the state?
Yes.
And is there anything specific they need to say? I mean, is it just their name, or do they need to say, this is Anlin Purdon and John Smith was here on 12/19 at 11 a.m.?
Yes, that's correct. Some of the software, I'm not for sure exactly how that third party is. Some of the software will have like an unable to capture, signature and
Right.
give you a reason. So if your software doesn't have that option, you just might want to jot a quick note, stating.
Yeah, it'll let them document that, the patient's paralyzed. So, I mean, so did you just say their name is okay, or do they have to spell out who was there and what time they were there and what date for the signature?
So if your software has that option where you can check box unable to capture signature, and reason, then, as long as that is captured by the staff, then you're good.
Okay. Then my next question is on secondary patients. So say they have Anthem, commercial, primary, and Medicaid's are secondary. Do we have to capture EBV on them?
You do have to capture the visit for a Medicare crossover.
For a Medicare crossover?
Yes. So if you had an individual that had Medicare and you were seeing them from a Medicare standpoint, you have to ensure that you're still capturing that visit for our KPI data.
Yeah, I'm so lost. If somebody can explain that to me.
Is that for a dual eligible, you're saying, April? So if they have
Correct.
Medicare and Medicaid, the Medicare visit needs to be documented. That's what you're saying?
Yes, it would need to be documented as a visit, a clock in, clock out.
Even if we're not billing Medicaid?
That is correct.
Yeah, that's totally new to me. I don't know how I missed that.
I didn't realize that either.
Yeah, that's a whole new ball, whole new game there. So, I don't know, I'm gonna have to think about that one for a while. Okay, so then back to so is it yes on the secondaries? Because of course Medicare pays 100%, so we wouldn't bill Medicaid secondary. So it'll be like Anthem, Humana, commercial, and then we're billing not EPSDT, but Medicaid secondary. Those need to be captured to be paid in the long run.
Yes, and I've made a note to make sure that we get our FAQs updated on that.
Okay. And my last question is, during one of the town hall meetings, they were talking about where we'll sign into the aggregator through COG. How do we get, like, even though I'm not up and running with their app yet, can I go ahead and sign up for that so I can have that ready?
I believe my understanding is you have to have your onboarding process completed, but I will take that as an action item and get a response out.
Okay. I think that's my questions. If Anybody else have any?
I've got one more. So April, am I safe to say that the email exchange you and I had has me covered to be able to be reimbursed after January 1st?
I have a couple follow-up questions that I will get to you, and then we'll continue to have that conversation.
Okay. You know, we're, it's not like we're not doing it. It takes a while to get through it. And just so that, you know, I want to put this out there. This is causing an additional expense to us, because like I said, we're having to explore, devices for our staff to be able to do this. And it's going to be about a $30,000 to $50,000 investment for us across our system to be able to capture EVV data. That's all I got.
All right, so we have a few follow-ups, and we'll definitely follow up on the duals question and you know, stay in touch on that one and look for the FAQs as well. Anything else on EBV for the group? All right, we'll move to updates on the DME fee schedule. I think we have heard that possibly for the supplies only folks, that's been updated. Is there any official kind of information on that from DMS or the cabinet?
Hi, Evan, it's April again. So where we are at on those codes is, testing's been approved and we're waiting for our MMIS vendor Gainwell to enter those codes into the MMIS. And then once we get those entered into the MMIS, then we can update the fee schedules accordingly. And we will make sure that once the MMIS is ready and the fee schedules are updated, that you all receive that update.
Okay, so just confirming, no fee schedules have been changed just yet.
No, the fee schedules have not been updated because
Okay.
we had tested the system and waiting for the MMIS to completely get those codes entered.
Evan, I've got one more comment about EBV if we can go back.
Sure.
April, I just want to, are you all aware of the amount of sales emails we get from Therapin a day? I mean, it is really ridiculous the amount of sales pitch emails we receive from them as a provider. It is constant.
That is a first for me. I appreciate you all bringing that to our attention. If Susan or somebody could send me one of those or a couple of those, I would like to take a look at them, and we will review that and get that looked into.
All right, thank you.
I have a question on the DME fee schedule, which it's not exactly what we were talking about, but where you all did release that now DMEs can do the incontinence supplies. I don't know, Evan, I think you had sent in a list of questions that Ted and I had come up with. Did we get an answer on, like, if they're a home health patient, do we still need to supply the incontinence supplies while they're our patient? Or can DME, is that just totally separate?
And I think we've shared that one in the past. I don't know that we've ever gotten an answer on that.
Does anybody with the state happen to know that answer?
Evan, if you had sent an email on that, I do not mind to get that recirculated and follow up with who we need to.
Awesome.
Not familiar with that email. I don't believe so. If somebody can recirculate that, I do not mind to try to coordinate a response.
Thank you.
Absolutely. We'll get that over to you today.
Can I just ask a question on that? is there a reason why you all would not supply them with items if they're receiving services from your agency?
I mean, we can. I was just gonna start moving my supply only, the incontinence supply only people over to a DME. But in the past, like with authorizations, like one agency couldn't be giving them incontinence supplies and then us doing visits because the auths hit
Right, but
against each
if you,
other.
like, I understand the supply only, but if you all are, if you're providing, I guess, those supports to them, specific services, is there a reason why you would not provide them with supplies?
I mean, if they're already set up with the DME and they're gonna need it, if they had it before we started and then are gonna need it after, it's just easier for them to not confuse it and just keep getting it
Okay.
from the DME. But I mean, we can, if that's gonna be required.
Okay.
That was just my question
Yeah, no, and I just,
before we started moving people over.
okay, no, and I know that I think is gonna send that to April, but it was a question that popped into my head. So
Okay.
just trying to get further information for my
Okay.
knowledge.
Thank you.
This is Marlene, and I have a question in regards to the DME and authorization as well. We basically got a referral. We could not get a PA because the patient was getting outpatient supplies, but we could not find out who that was with. The state would not share that information, and we had a real struggle, which caused a negative impact to that patient not able to receive services.
And did you speak to somebody like within Medicaid?
Yes, the agency did, and they would not give us any information on who the DME company was.
Okay, maybe maybe send that email as well to April so we can do just some further research on that.
I will, thank you.
Thank you.
All right, anything else on the DME or supply only fee schedule? If not, we'll go down to the KOG, sorry, site delays and authorizations. I think a couple folks on the TAC were having issues there, so I don't know if you want to describe with more details what's happening, but I think it's an issue that more than one agency is experiencing.
For us, it's just that there's a long delay in actually getting the authorization, because I know somebody else was having a problem with what they were submitting. So we don't often have them come back and ask for more information. I mean, we just submit it and, I mean, weeks and weeks waiting on that to go through.
I think Toyotas was having that issue too, but we heard from another agency as well that, they would consistently request the map forms, and then the agency would just include the map form in the submission, and it would still ask for the map form. So Toyota, sorry to interrupt. Go ahead.
No, it's just the same thing that we getting requests for the information that we already sent on the original request. We're getting a lot of additional information requests, and when we open those, it's exactly what was saying on the original request. So we don't understand why we keep getting, a request for more information when the information that they're requesting was already submitted. Right now, we got requests from early November that still have not been processed.
Okay,
April, do you want me to talk on this?
I was gonna say, I was getting ready to pick up and speak on it. So, with any vendor implementation, we know that there's gonna be bumps in the road. Our team across the department has continued to meet with Gainwell and Carewise on that transition daily. And if you all can send to us, you can send it to me and we'll make sure we get those examples over, that where you all are struggling. So we're happy to work to coordinate that and try to work out some of those bumps that you all had experienced. So we're happy to coordinate that. But I do need to see those examples so that we can help you all through this transition period, okay?
My other thing is on those requests, so instead of just putting the information that's missing, you guys actually, requesting for us to put in the whole request again. So it's not only that we had to just submit one piece of information that's missing, you had to recreate the whole PA pack and send it again. Would it be possible that instead of doing that, we could just submit whatever piece of information you guys are requesting, not the whole package again?
So just one piece or one note on that is, I think I heard you say earlier that say you sent it in the early part of November. What I've learned on those meetings is when the transition from one system to the other system, it did not bring over the previous documentation. So say you submitted it on 11/1, and the easiest way is for me to give an example. Say you submitted it on 11/1, but you got an LOI and you didn't submit that LOI information back. If it was on the new system, so after 11/13, then there's that disconnect. I know that they were trying to identify how many LOIs they had out there, but in those instances, if it's going to be over that cutoff date, the best thing to do is to resubmit everything that you submitted with the prior auth the first time, and then along with if whatever the LOI was. So if you needed an additional document or signature or something like that, just resubmit that packet if it's going to go through that cutover period.
All right, so we've been doing that, but so I can understand, but you say anything after November 13, that would not be the case. We're not gonna have to recreate the whole package after that November 13 cutoff day.
Right. If your first submission was after go live of the implementation of the new system, then you shouldn't have to resubmit like the entire packet if you get an LOI. But if you had originally submitted for an authorization and through the old system is what I'll call it, and you got an LOI, but you didn't respond to that until after the new system went into effect, that is that period of time that you're going to have to resubmit everything.
All right, thank you.
You're welcome.
And we'll be sure to follow up with some examples on what we're hearing from members, if that works. And can we do that with, is that with you, April, or Alicia, is that with you?
Can submit those to myself, April, and like I said, I'm getting ready to drop in some links for EBV, HHCS, and also my email address.
Perfect. Thank you so much. All
And
right.
Evan, I'd just say that for any of the issues that you've been hearing, just make sure that it's not like a broad thing, like give us like case examples, Medicaid information, so that we can make sure that we always track it back to the specific case. So we can ensure that, a full and thorough research is being done and we're going directly, instead of it just being like a hearsay or something like that. I always like to have those very specific examples. And I know April does too. So just wanted to, so we don't have to email you back and be like, oh, can you provide this, this, and this? So.
Sure. No, we're
Thank you.
happy to dig in on that.
Thanks, Evan.
You're welcome. All right. You want to keep going in, Len, or you want to jump back in? All right. We'll jump down to general discussion. Any updates from our MCO partners, billing issues, PAs, any other home health information? So if the MCOs that are on, if you want to just jump in.
Hey, Evan, this is Holly with Anthem. We don't have any updates or issues to report at this time.
Hi, this is Anna Page with Passport. Same, no issues to report at this time. Hi, this is Carrie Wilson with Humana Healthy Horizons, and we don't have any issues either at this time.
Good
This
morning.
is
This is
Crystal with Health. We also don't have any issues. The only type of denials we're seeing coming through is just your standard PA denials and things of that such.
Good morning. This is Aaron Meek with WellCare of Kentucky. We examined our auth report and we approved 98.59% of home health related auth requests. On our claims report, the top denial issue would be a duplicate claim. Other than that, we engaged with our claims SMEs and teams, and they informed us that they have no major issues or trends, so nothing to report on that front. Thank you.
Hi, this is Altina with United. We have no issues to report.
All right. I think that covers us on the MCOs. Any updates from DMS? Nope. And or Commissioner Lee?
Evan, this is Erin. I don't have an update, but I do have a quick request of the TAC. If I could have just a moment.
Sure.
Okay. Don't laugh at me, but this pertains to your December meeting next year. Looking through the calendar, it looks like there are 2 meetings that kind of hit right against each other, and I want to make sure that we have enough DMFs staff and MCO staff. Is there any way we could possibly tweak the time on that meeting from 11 to 10:30? So 10:30 to 12:30 instead of 11 to 1?
That works for me.
Yeah, I don't think that'll be a problem.
Plenty of time to adjust your calendar.
Okay. Most appreciated. I appreciate that, guys.
Yeah, thank
And
you.
I know
Probably
a
forget
lot of
by
staff,
then.
a lot of staff
You'll have to
will,
remind us.
I will update it on the calendar invite after the meeting, and then we'll have it on the website, and we'll do a friendly reminder because I myself might also forget by that time as well.
Sounds good. Thank you.
Thank you, guys.
We don't have any recommendations today. And likewise, Susan will be our ongoing MAC representative. So last items, the February meeting, February 13th, 2024, same time, 11 o'clock.
And then I think we gotta circle back around and approve.
Oh yeah,
the
you gotta
minutes.
approve the minutes. Yep.
We had a motion and a second, so now I think we've got Marlene and Teotis back. Is everybody in favor?
Yes.
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 Yes. Oh, now I think we did it. All right.
All right.
Anything else for the good?
Actually, I would like to ask, I know we asked for this before, but can we get a updated list of NCO agency representative? We are having a difficult time getting somebody from WellCare to help with the WellCare portal. And when we just call the regular customer service number, they're having a hard time understanding what home health is and how to help us. So is there any way we could get that list of direct representative for home health?
Yes, I can request that from the MCOs. I can ask them all to send me a list of the best contact person.
Thank you.
And just quickly, this is Aaron Meek from WellCare. I'm not dedicated specifically to home health, but I'm going to leave my email in the chat, and anyone can feel free to email me, and I'll make sure to transmit any of those concerns or requests to the members of our team who can help.
Thanks, Aaron.
All right, anything else?
That's it
All right.
for today.
With that, we'll be adjourned. Want to
Thank
thank
you all.
everybody
Appreciate
for
it.
attending, for
Thank
the
you.
information. Have a good day.
Thank you, everybody.
Thank
Have
you.
a great day. Happy
Thank you.
holidays.
You too.